Hello and welcome to another OET All-Star presentation. Our topic for today is all about listening part B. How do you choose the best answer option? Master OET Listening B with our targeted grammar workshop today. Our session will equip you with strategies to analyze the type of grammar that will enable you to approach part B precisely and confidently. Before we begin, please let me introduce myself. My name is Grace Dalgety, or Teacher Grace for short, to our students. I am the Managing Director and one of the teachers here at SGR. I have been teaching OET for more than 7 years now, and I am the lead OET trainer for SGR Focus Training, which is a company based in Scotland in the UK and in 2 locations in the Philippines, namely Aklan and Iloilo. SGR is an OET premium preparation provider in both countries and the first and only premium preparation provider in the Philippines. We offer OET training mostly to nurses, doctors, pharmacists, occupational therapists, and other healthcare professionals who require our support in preparing for the OET exam. For those who are watching us today, may I ask if you could share your name, where you are from, and whether you are preparing for OET as a doctor, a nurse, or pharmacist, or any of the other remaining professions who take OET. We would also like to know perhaps you'd like to share your challenges in listening and in Part B in particular. So for today's lesson, we will be looking at the structure of listening Part B, the context, question, and answer option. Then we will discuss strategies for identifying what information we will need in order to focus on once the recording begins. We will discuss various grammar techniques, and finally, we will do some practices to check for understanding. By the end of this lesson, you will learn how to identify the different parts of listening Part B. You will learn the different grammar words to help you understand the question and what information you need to focus on. You will be able to make better choices in your answer options. So let's begin. Let's look at the overview of listening Part B, its format and its structure. At the top is your setting. This part tells you who and how many speakers there are in the recording. In this instance, we can see that we have 2 speakers, a nurse and her colleague. One will always be male and the other one will always be female. The setting also tells us what they will be talking about, something about a patient. The question is in the middle. It identifies the person that we need to focus on and what information we need to listen to. In this instance, our focus will be on the female nurse, she. She will be the one to give us the answer. The last part is your answer option A, B, and C. This is the one that we will discuss today. How do you choose keywords based on grammar? Which keyword should we listen to? Which one is the best answer? Let's discuss. In the setting area, we need to identify nouns. Nouns are commonly defined as people, places, or things. They address the who or the what of a sentence. The most reliable sign that a given word is a noun is if it follows an article like the, a, or an. So our speaker 1 is a nurse and speaker 2 is a patient. Adjectives can be written between an article and a noun. An adjective describes a noun. Now we know that speaker one is a nurse that works in a hospital. This tells you that the patient is currently admitted in hospital. Now let's look at the question. The question includes more nouns and adjectives. We focus on the main noun. Which one out of our speakers, the nurse and the patient, should we focus on? In this instance, the question tells us we need to focus on the patient. What is it about the patient that we need to know? In this instance, we see a verb, expresses. What is he expressing? Expressing means telling or informing. He is expressing a concern. So, a verb is a word that tells us what that person is doing. So, he is expressing a concern. The last word you see in the question is the word about. I will tell you more about this word later, but an about in your question tells you that you're looking for the subject of the concern. What is the patient concerned about? Let's find out by looking at our answer options. So, what is the patient concerned about? There will be three answer options. Answer option A, B, and C. Your job is to identify their similarities and differences, again, using grammar and vocabulary. We need to identify nouns, adjectives, and verbs. In option A, we see the words mobility and aid, a mobility aid. In B, we have to mobilize without assistance, and C is when he is attempting to mobilize. What do you think are the synonyms of these underlined phrases? The reason why it's important for us to think of synonyms is that your recording has the possibility of using synonyms or paraphrasing instead of using the exact words on your answer options or on your question. So, the phrase use of a mobility aid means devices that helps people move around, such as a wheelchair, a wheelie walker, a cane, crutches, stair lifts, and others. While in part B, it says to mobilize without assistance. That means that you do not need anybody to assist or to support you, which means you are moving on your own or independently. On option C, it says when the patient is attempting to mobilize. That means when he is trying to move. So, which part or which one out of our answer option is the patient concerned about? Is he worried about A, the use of a mobility aid? Is he worried about B, to mobilize without any help from anyone else? Or is he worried about attempting to mobilize on his own? To choose your answer, you must make sure that when you hear mobility aid, which is option A, it is discussing the patient's concern or worry about using them. If he is not worried about his mobility aid or any support, then the patient is not concerned about this and A is wrong. If you think B is the right answer, the recording must say he is expected to mobilize without someone assisting or supporting him. If in the recording you hear the patient can do things on his own or can do things independently, then that means B is incorrect. To choose letter C as your right answer, the patient must tell us that he feels unsteady whenever he is trying to move. If he tells us he is stable, he can walk, he can move steadily, then that means C is wrong. If you are ready, here is our recording. Please choose the correct option A, B, or C. What is the patient concerned about?
Now look at question 25. You hear a hospital nurse talking to a patient. Now read the question.
Hi there, I'm Dory. I'll be your nurse while you're here at the rehabilitation centre. How are you feeling today?
Okay, just a bit tired after the surgery.
That's understandable. I need to go over the falls policy with you. As you know, falls can be a significant risk for patients, especially after hip replacement surgery like yours. It's important to take precautions to minimise the risk of injury. Are you familiar with the policy?
Well, I know to use the call bell if I need help getting out of bed and to use my frame when I'm walking. I was told to keep my personal belongings within reach and report any spills immediately. What worries me is that I keep coming over dizzy when I go to stand up. I guess I should just keep still and wait till it passes.
You certainly shouldn't try to move. And press your call button if you can, and we'll be straight with you.
Okay. So please type in your answer now and let's discuss. So in our question and recording, we need to find out what is the concern of the patient. We've got option A, he is worried about using a mobility aid. In option B, he is worried about mobilizing without assistance. And in option C, he's worried about being unsteady whenever he is trying to move. In the recording, we hear that the nurse was introducing herself to him, saying that, he is at the rehabilitation center and asked the patient how he is feeling today. The patient says, I'm okay, just a bit tired after the surgery. And then we hear the nurse speak for a long time, talking about a false policy. Now, I'm going to read the rest of what she mentioned because if you remember our question, we are focused on what the patient is concerned about, not the nurse, okay? So I'm going to move forward and show you the script about what the patient has informed us in the recording. So the patient said, well, I know to use the call bell if I need help getting out of bed and to use my frame when I am walking. So he says he knows how to use the call bell. Okay, that is something that can assist him if he needs to get out of bed. And he also know how to use his frame. And a frame is a mobility aid. So if he knows how to use both of them, then that means that letter A is wrong. It is not his concern. So we continue listening. The patient then said, I was told to keep my personal belongings within reach and to report any spills immediately. There's nothing in our option B and option C which requires talking about personal belongings. So that means we can then continue listening. So the patient then said, what worries me is that I keep coming over dizzy when I go to stand up. I guess I should just keep still and wait until it passes. So the phrase, what worries me, is synonymous to the word concern. And then the words that says dizzy, okay, and standing up is synonymous to option letter C, feeling unsteady when he is trying to move. The movement or the mobilization is standing up and dizzy is unsteady. So our correct option is letter C. I hope everyone got that. Let's move on to another example. So in listening, question number 26, we are going to hear two community nurses conducting a patient handover. Now, what you will notice here is that we have a plural noun, nurses. That tells you that our two speakers are both nurses. They are community nurses, and there are two of them. So we've got speaker one and speaker two. Now let's look at what are they going to talk about. They're going to talk about a handover of a patient. Now that we know who our speakers are and what they're going to talk about, let's look at our our question. So the question again tells you what information you need to focus on. So again, our focus should be on the patient and his need for guidance in dealing with something. I wonder what he needs guidance from. Okay, so let's now look at our answer option A, B, and C. Because we've got the word with, that tells you we are looking for nouns. Okay, and our noun on option A is the regular medication. Okay, so medication is the noun, regular is your adjective. And then we've got on B, ongoing therapy. And then on C, we're going to talk about a health condition that he's developed. When you say something that he's developed, it means he didn't have it before. This is a new medical problem or a new medical condition. So we are looking for something that he needs help with. When you say he needs guidance, he needs help, okay? Where does or which one does our patient needs help from? Is it about his medication? Is it about his therapy or something that he's developed, a new medical condition? Now, when you are listening, always make sure you know the specifics, okay? So the medication is not just any medication, it's the one that he needs to take. The therapy is not just any therapy. This is a therapy or a treatment related to his long-term illness. And then it's not just a health condition he's developed, but something about the sensitivity associated with it. Let's listen.
Question 26. You hear two community nurses conducting a patient handover. Now read the question.
My main concern is Pavel. He's an 85-year-old male who has a diagnosis of vascular dementia. He lives at home with his wife, Maria. She has her own health problems, but generally seems to manage well, and there's a daughter living locally.
Okay.
Pavel had a significant ischemic stroke 5 years ago, and since then has presented with memory problems and occasional non-distressing hallucinations. He has some expressive dysphasia and dribbling of saliva, for which a speech pathologist offered conservative advice. He also has COPD that he self-manages with inhalers. He was diagnosed with a hydrocele, which presented shortly after his dementia diagnosis and causes him a bit of distress. He keeps forgetting it's there, so you may need to go over with him how to avoid discomfort when sitting down or using the bathroom.
Okay.
Okay, so we heard the two nurses, okay? It's the female nurse that was talking a lot and explaining things and making recommendations. And the second nurse was the one that was listening and saying, okay. So in this recording, we heard the female nurse mention a patient called Pavel, who is 85 years old, diagnosed with vascular dementia. Now, Pavel is married and the wife has her own health problems, but generally seems to manage well, okay? So at this point in time, we've not heard anything about medication, okay? We've not heard anything about a therapy for Pavel. We've not heard anything about a new medical condition. So we continue listening. What she said next is that Pavel has a significant ischemic stroke 5 years ago. There you are. We've now got a long-term health need, but we've not heard anything about a therapy yet, okay? All we were told is that he presented with memory problems and occasional hallucinations. So in this instance, even though you heard a long-term need, the stroke, there is no ongoing therapy. So you cannot answer letter B. Let's continue listening. The next thing that the nurse informed us is that Pavel has expressive dysphagia and dribbling of saliva, for which a speech pathologist offered conservative advice. Again, we do not have any regular medication yet. We do not have an ongoing therapy, and we do not have a medical condition. All we heard was that he got an advice, okay? No therapy yet. Again, we continue listening. We were also informed that Pavel has COPD that he manages with inhalers, okay? We've got the word inhaler, which is a therapy, okay? And then he said it's related to his long-term need, which is COPD. So we heard everything about letter B there. The therapy is inhaler. Long-term need is COPD, but it is still not the right answer. The reason is, if you come back to your question, you need to find something that he needs help with, may need guidance to deal with. At the moment, we didn't hear that he needs help here. So even though you heard everything about B, it is the wrong answer. We then continue listening. We heard that he was also diagnosed with hydrocele, which presented shortly after his dementia diagnosis. Presenting shortly means a health condition that he has developed. It's a new one, okay? And then we were told that he keeps forgetting that it is there, that he may need, or we may need to go over with him how to avoid discomfort when sitting down or using the bathroom. So there is a recommendation from Nurse 1 on what Nurse 2 needs to do, that Pavel, our patient, needs guidance or support or help on how to avoid discomfort when he is sitting down or using the bathroom. So I hope you got the right answer, which is letter C. So in order to summarize what you've learned today, by using grammar such as nouns, adjectives, and verbs, you are able to find out who the speakers are. When you're looking at your question, you can identify whether the question is looking for a verb, a feeling, okay? When you say verbs, again, these are action words. So what is our what is our speaker feeling? Is he worried? Is he disappointed? Or is he nervous? So if you see a verb in your question, look for verbs in your answer option as well. Remember that you need to focus on the information that you are going to listen. So if you hear that he is worried, answer is A. If you hear that the patient is disappointed, then the answer is B. And when you hear that the patient is nervous, then the answer is letter C. Okay? So it is all about knowing how to identify these words. Now, if we look at this next question, the question is now talking about another concern. Concerned about what? Okay? So when you're trying to answer a question, what, our focus will now be on the nouns, the adjectives, and anything that makes the answer option specific, okay? So we are going to listen for a log test, and it's not just the log test, but it has to be the result. We're going to listen for side effects, but not just side effects. It's got to be post-op. We're going to listen to the patient's consciousness, but not just consciousness, it's got to be the level of his consciousness. And in A, the result needs to be incomplete as well. And in B, the post-op should only be, or the post-op side effect should only be a possibility. So as you can see, when we're looking for, like nouns and adjectives, we need to make sure, that all of your answer option is correct, okay? Everything there must be a match to your recording. Now, one of the words that we've worked on today is the word about. Now, about is actually a preposition. So a preposition is a word or a group of words used before a noun, a pronoun, a noun phrase, etc. Examples of other prepositions include in, on, at, and over, under, and between. When you understand prepositions, you understand which answer option we should listen to. There are also other grammar words that can help you when you are answering an OET exam, and that includes the use of modals, okay? Like the word should in here, that tells you you're looking for verbs. Another good grammar to understand are adverbs of degree. Basically, it's a word that modifies or describes your adjective, but it also tells you by how much. So we're not just listening for something that the patient is concerned about. It's got to be the one that he is most concerned about, meaning the most important to him. To her. Is it her weight, her new treatment regime, or her abdominal discomfort? So all of these grammar can help you identify and choose quickly and correctly what is the best answer option out there. Okay, so don't forget, don't just memorize exam formats. You need to master the language itself, and you can do this with SGR Focus Training. Our unique approach goes beyond typical test preparation. We offer one-to-one intensive classes or group intensive classes. We also offer intensive self-study online, as well as providing you with listening mock tests, okay? Our unique approach helps you identify and deepen your understanding of language, okay? We teach these in our one-to-one classes. It is a personalized service based on the assessment of your strengths and your weaknesses. We interview every student to find out what their previous scores were, or we ask you to take a mock test for a detailed assessment. We then design the class based on your needs. Every class will be about 45 minutes to 1 hour long. You can choose the subtest, the day, and the time of the classes that you want to study. You get access to OET Pass. You get access to practice activities, homeworks, and mocks. And lastly, most importantly, you get comprehensive feedback for each of the homework you submitted and mock tests. Now, we also have intensive group classes, basically for those that wish to join our group. Each of our class is a minimum of 3 to a maximum of 10 students. You can choose to attend all of the group tutorial, or basically just choose which one you need help the most. Is it, just listening? Is it just reading? Or it could be writing or speaking. Now, every group class is, showing live practice with discussions, and there will be tutorials on weekdays or weekends, depending on your needs. So each or all of our students have access to their courses within the learning management system. Our fundamentals of OET is free to all our SGR students, which gives them the basics of the test. From here, they can choose the course that they want. And then basically, once they are on the course, it opens up with the list of topics on the left side of your screen. You can study them chronologically, which is our recommendation, or you can click on any separate area you wish to know about. The lesson opens up, whether it's a video, a text or a PDF material or any of our multimedia interactive lessons to help you learn, practice, and improve. To get in touch, please simply chat with us on WhatsApp or get to know what we have to offer by going through our website. Join our successful alumni of OET test takers, book your class today, and experience the SGR difference. When you are ready to book for the exam, SGR is also a partner of OET for test booking. You can use our direct OET link, www.oet.com/SGRFT, or simply scan the QR code on your screen. For every successful booking, we will give you a free OET online course. Thank you very much, everybody, and good luck in your exam. If you have any comments or questions or anything that you find challenging, please don't forget to write down your questions and comments down below on the video, and one of the teachers of SGR will be answering or replying to you. Again, please don't forget that you can chat with us via WhatsApp or go and check out our website if you want to book your class now. Thank you again, and bye for now.